Finally, the researcher deceives the participants and the coaches because he doesn't tell them about the side effects that may come with taking the drug. And this is also known as omission because the researcher hasn't lied about there not being any side effects, but he hasn't mentioned them at all. And again, this is ethically incorrect as the researcher has the responsibility to make sure that he informs all the participants and the coaches about the whole study and making sure that he doesn't miss out any small details. So to fix these issues, the researcher must make sure that he gets consent from all the correct people, which in this example would again be the parents, participants or carers. They must also make sure that they show no signs of equality or bias, as this could cause participants to feel left out and upset, meaning that they're psychologically harmed, which is again unethical. And then finally, the researcher must make sure that they inform all the participants about the full method of their study and make sure that no bits of information, such as the side effects of the drug in this scenario, are left out. Consequences that the researcher could face if his study has these ethical issues include losing their basis accreditation due to poor ethical and legal control within their study, fines or risk of being sued due to the harm that the participants have suffered, and also prison sentences due to giving children drugs that haven't been tested previously and again not having consent from the correct people. So the third scenario looks at the effects of altitude training and whether it has an effect on young athletes. And so a group of researchers have used young gymnasts from a local club, and they've asked them to perform in an altitude chamber where they will alter the pressure levels and see what effects it has on gymnasts' performance. So in this scenario, the researchers have done the right thing by getting consent from the participants' parents, as they're under 18 and so they can't give legal consent themselves. However, the researchers have misinformed and deceived the participants because they haven't told them that they will only experience pressure at 5,000 feet, whereas the researchers actually decreased the pressure even more just so that it would be more suitable for their study, rather than taking into consideration the effect this might have on the participants. The researchers also didn't do a PARQ or risk assessment, meaning that they had no idea of any potential risks or what kind of health condition the participants are in. And then in addition to this, the participants' data was not kept anonymous and their private personal details were given out, meaning that the researchers did not follow and abide by the Data Protection Act. So to fix it, these issues can be resolved by making sure that all participants know the full protocol of the experiment that they're taking part in, because if they know all the details, they can make a decision if they really want to take part. And it's also important to carry out a risk assessment and PARQ so that you can identify any potential risks, and then you work out how to reduce or remove them. And then a PARQ will allow you to understand the participants' lifestyle better and also to know whether they have any specific health conditions, and also get a general idea of their lifestyle. And so, it's important that you keep all the participants' data private and anonymous, as this data can contain private information like it did in this example, and this data is something that these participants might want to keep confidential. So if we look at some of the consequences that the researchers could face, they could include being forced to go on an ethical training camp, or being reviewed by better researchers. And so this will allow the researchers to understand and refresh their memory about what their job is as a researcher. Also potentially being sued due to the harm that the participants suffered when in the altitude chamber. And then finally, losing their BASES accreditation because of the leak of participants' information. So the final scenario is about a researcher who wants to use some gymnasts and test them to see how long lactic acid takes to kick in. He picks participants from a group of gymnasts and he tells them to perform a routine, and he just says that he will stop them every minute so he can conduct some research and perform some tests on them. He carries out a PARQ, but he fails to inform them about the whole procedure, and only after they start performing does he mention that he will need to withdraw blood from them using needles. So things that are done well in this scenario and are ethically and legally correct include the researcher allowing participants to withdraw. So because they all have the right to withdraw at any point during the study, even if he doesn't want them to, they are still allowed, and they must know that they have this right. He also performs a PARQ so that he can understand the gymnast's like and dislikes, and as well as their health condition and lifestyle. However, he fails to get volunteers because he picks who he wants to take part, and this is ethically incorrect, as all participants in any research should be volunteers and they have to be willing to take part. However, in this example, the participants are not volunteers, they are forced to take part by the researcher as he picks them, and so he is not following the BASES code of conduct. He also doesn't get consent from the parents of the gymnasts, which is vital, again, seeing as they're all under the age of 18. They can't give their own consent, and so he needs to get that from their parents or carers. Furthermore, he deceives the participants by not telling them about the needles and other information about the study, meaning that the participants aren't fully informed about what will happen. And finally, there's no aspect of protection from harm because the researcher shouts and gets angry towards the participants who withdraw from the study, and this shouting can cause psychological and social harm for the participants, which once again is ethically wrong and against the code of conduct produced by BASES. So to fix these issues, the researcher must ask if there's anyone who wants to take part. So this will mean that any participants he does have are volunteers and they're not forced to take part in his study. He also needs to make sure that he gets consent from the gymnast legal carers, as they're under the age of 18 and so they're legally unable to give consent themselves. And as well as this, he needs to make sure he tells them about the whole procedure so that they fully understand what's going to be happening to them during the study. And finally, some of the consequences he may face as a researcher if the study does include any of these issues would include him losing his BASES accreditation because he hasn't followed the code of conduct, and so a study is not acceptable to carry out. He may also have done something. He may also have to do some ethical training so that he can conduct so that any future procedures he carries out will be BASES acceptable. And finally, he's at risk of getting sued or fined due to the harm that he's inflicted on those participants by shouting rude comments at them.